acknowledgement or welcome?
I'm happy to do it if you'd like.
Oh, thank you, Kate.
I'd like to acknowledge the traditional custodians on the land from the lands on which we're meeting today. May we follow their true respect and leadership for this beautiful earth that we live on, and care for this land, notice this wonderful earth that we're able to experience, and certainly follow their leadership.
Beautiful. Thank you. And so following the agenda, we've got, well, we did welcome and introductions. So we know what we had for lunch, or in Fahim's case, what he's going to have when he breaks his fast. But let's see, let's just do a quick go around of who you are, maybe like a little brief summary about like your involvement with, ADF and LDAT. How does that sound? And I'll just kick it. I'll start. So I'm Jesse Taylor. I'm the Community Development Manager for the Mid-North Coast of New South Wales. I've got a few other roles with the organization and externally, and I've been involved with the ADF's LDAT program since inception and before with their, when they used to have the CDAT program. So it's probably been, I was talking to Leanne about this. I think it's probably been about like 12, 13 years, I think. It's been a long time. And so that's me. And I've been involved with the CAC. What was it? Was it just 1 year or two? I don't remember. But yeah, it's a real honor to be here with you guys. And with that, I'm going to hand it over to Emma.
Oh, yeah, so I'm Emma, obviously from Perth, but you might tell from my accent, that's not where I'm from originally. I'm from Wales, but I've lived here since 2017. And since that time, since my very first job role that I had here, I've been involved in local drug action teams. So I established one in the northern suburbs when I was working with a not-for-profit there called Mercy Care. I then moved roles closer to home because I lived south of the river in Perth, and facilitated the local drug action team for the city of Mandurah, which was run through the youth development team. Since then, I've moved roles. I've gone back to not-for-profit working in an organisation that works with people involved in the justice system. So I don't have any connections at the moment with the ADF or LDAT in that role, but in my private life, I am the chair of the community-led Rockingham LDAG, which has very recently been supported by the ADF. Previously, it was supported by the WA LDAG. Yeah, so that's my background a bit and my connection with the ADF. So yeah, been quite a few years connected over a number of different projects.
And Emma presented at one of our community practice sessions back in December, was it?
Yeah, a few months ago, a few months back. Yeah, yeah.
Thanks. And your relationship manager is Bob from ADF?
Yeah, Bob Shanks. Yes, yeah.
Oh, I should say, and I'm with the Coffs Coast Youth Local Drug Action Team, formerly of the Gumbaynggirr Youth CDAT turned LDAT. Okay, Emma, who do you want to have follow you?
I'll go to Kate.
No problem. I am Kate. I'm the school programs manager for Blue Light Victoria. So we have a number of programs that are funded by an LDAT in different areas. So we've got Melton, Southeast, Inner Melbourne, and we've just begun work with each who have got the Knox and Maroondah LDAT. So we're delivering programs in high schools. So high school programs, our Blue Edge program, we partner with police to deliver that in the schools. I've been working with Blue Light for about a year. It's been quite a busy and dynamic few months, but it's really interesting and great work with young people, helping them understand themselves a little bit more, build some positive relationships with police, which is really important for that age group, and certainly give them that education through our program content around a whole number of factors and in topic points around mental health, well-being, and certainly AOD. So yeah, that's me. Short and sweet.
And who are you going to hand it to?
Fine.
Sorry, was that me?
Yeah.
No, phone, sorry. Yeah.
Oh,
Am I cutting out a little bit?
Oh, yeah,
Okay.
yeah, you're cutting out.
yeah, with the dropped off, I don't know why. So Rahim, I'm South Australia based, working with CASA, Community Access Service, 3.5 years. And before that, I used to work with Life Without Barriers and a couple of other organizations, and mainly mental health. But last 2.5 years, just moved to a program as a case manager for South Australian here, and also community educator. We are providing like research and doing surveys and do some click of the community. The main project that we come up with a survey on youth, which sort of media of that to get into the youth's mind and to find out how we can help them things. And yeah, that's me, South Australia. Happy to be here. And
Thanks, Fahim. Leanne, you already did it, but do you want to say a little something else?
Yeah, no, yeah. Hi everyone. I think you know who I am, but yeah, LDAT program manager and representing my team and been involved with the LDAT program since it started. So it's really great to be in this role and have a different capacity. And yeah, great to meet you. We've been trying to get the group back together again for a while, so it sounds like a rock band, doesn't it?
Blues
But
Brothers.
there's some rock
Blues Brothers.
stars, existing
Yeah.
rock stars, and some new ones. So yeah, really looking forward to it. Really excited about having representation for each state and territory except for Tasmania. So we're still doing some work in the background to try and get someone from Tassie, but I've got a potential member from ACT. I just haven't been able to actually talk to her. She's keen, but I haven't been able to talk to her. So yeah, really great to have you on board and meet you. Thanks.
Great. Thank you, Leanne. I mean, when you do engage with these people, right, that we're going to be talking to them about being, superstar external advisory members, right, of the LDAT and the community of practice, and that we're informing the community of practice work plan, and that we're generating insights and community needs and interests and the priorities for the communities of practice.
Very good.
I'm
Yeah,
sure you'll
well
do
done.
I'll sure you do an amazing job, because the people that I know that you will engage will, like the people who are on this call, just be natural leaders and champions of the LDAT and the community and wider. And so obviously I've transitioned right into our 3:45 spot 1 minute earlier on the purpose of the CAC. And I do appreciate everybody's willingness to be involved and to participate and to bring that, really, you guys all have like really amazing communication skills. And so I do appreciate that you bring that, and that I look forward to learning from you, and that we all learn from each other around, how we're engaging our stakeholders and our partners who are involved in the LDATs. We also all bring a passion for community development, knowledge management, and approaches to community of practice, as well as education, like Emma has provided back in December into that wider network. Yeah, it's oh, was it? Apologies, my internet is not the best. Oh, that's okay. Thanks, Kate.
Hopefully you have me, but I kind of tend to drop in and out, so hopefully I've got it sorted for you. Sorry.
No, it's great. And so, like, for Leanne, I mean, I'm sure you've already done all this, but we just want to confirm that everybody is happy, to be part of the advisory group and to, maintain visibility and oversight, of the work of the community practice work plan, including like planning and implementation.
Yep.
Do like a little pinky thing, right? And has everybody read through the terms of reference?
Yeah.
Yeah. No. Kate? No. Yeah. No. So just under, like, I'm just gonna just hit some points under role, guys, just so you guys are across it, that we're gonna, identify, communicate, and represent the interests and needs and opportunities of the LDATs. Leanne, how many LDATs are there? Do we know about? There's a lot.
There are 274.
Big. Okay, that's huge. Okay,
Yeah,
and
yeah, we're a big country.
Yes,
We
big
have a
org.
lot. Yeah.
And that we're supporting the planning of the community of practice work plan, that we're providing feedback, and that we're, as well as, the progress of, supporting quality and positive outcomes. It's also that we are advising and identifying like local LDAT needs, and so things that you see happening in your neighborhood, as well as opportunities for community of practice. And so that can include, you might find an amazing speaker, and we can, look at like how do we integrate some of those ideas into what we're doing, as well as like emerging areas of interest, which also can be advised, to the LDAT, sorry, to the ADF as well as the LDAT. Um, I see that we all have a background in community events, and we just want to promote, the community of practice, as an event related to, our ADF LDAT activities, as well as the promotion of the ADF Community Hub, and that from time to time we might be involved with the media or external audiences. That's the main role. And then underneath of it, they've got some other points. I'll just hit some key things as well, and just that we're bringing experience around brokering partnerships and capacity building. Look, I mean, we're all professionals, and that we're going to treat each other like that, but that we can learn from each other about ways that we can work differently, and like capacity build and support each other. And I think that's one of the real benefits and opportunities going into the community advisory council, and something we can take away from it. So I don't want it to necessarily feel like we're just coming into a blank meeting, we're just a placeholder, we're just rubber stamping stuff. It's something that we're just going to say, oh yeah, it's just something I do. But I want to feel like we can learn from each other and use this platform to learn from each other, as well as think about how we use like, for example, like how we use language out there in the community, to just help shape, people's experiences of working with communities around alcohol and drugs. Um, and so the other point is just around like time availability, and and making time availability is something that we all do. We multitask, and if we can just like stay focused with each other while we're together, so we're not multitasking, I really appreciate it. You can see it all the time. Like people are like, they zone out, or they're wearing glasses. Now these are not real glasses, because look, I can put my fingers through them. But you notice, like, what you can do, when people have their glasses on, and for people who wear glasses, if you don't know this already, I'm gonna tell you something. Sometimes they reflect, and you can see that they're looking at other things.
Okay. Noted. Eyes are on you.
Yeah, so be aware.
Okay. Take the
And
glasses off.
It's a dead giveaway, is it? Yeah.
yeah, totally.
Creates other
And
problems.
like, from time to time, like, I mean, like, I wouldn't make myself available to you, and if we could all be available to each other. And so, you might say something, Kate, and I'm like, wow, I really want to follow up and talk to you about what you just said with, each and Victoria and blah blah blah. And if we can learn and coach each other, that would be really appreciated. So it's a bit of an investment, but I think it's going to be rewarding for us. And so I'm grateful that you guys are here, and for the people that were unable to be here today to hopefully be with us on the next one. So going into that, if you guys can like read any of the documents in advance, like just get your heads across what we got to go into, that would be really handy. And if you can attend meetings or send somebody else, and just share information across all of us. And if you have any conflicts of interest, please state them. And if you have any other, matters, which may affect, the community of practice project, just let us know. And look, just keep contributing to open and honest conversation.
Thanks, Jesse. That sounds great.
My pleasure. I'm really
Um,
excited to be here with you guys, all of you.
I had actually read that document. I forgot which ones I got to, but I did read that one. So yeah, no, it's good.
Well, thanks. Yeah, and I just wanted to reiterate that this is really a group for LDAT. So it's an advisory group, but it's not necessarily advisory group on the business as usual stuff that we're doing for the LDAT program. Obviously, we as an organisation, ADF is responsible for delivering the program, but it's really just around, I guess, the real value add for us is having your advice and guidance, particularly around that community of practice model, so, and particularly the community practice sessions, so just helping to guide us and representing the LDATs in your communities. Things like, you know, topics and how we best run them and represent and reflect the needs of the community. So, and just putting in perspective the purpose, I guess the primary purpose of the LDAT program and its origins was around that community capacity building. So we're not a grants program. We're really about that grassroots community development, which you know you will work in, and the program is designed to build that capacity. So obviously the COP sessions are around trying to do that and facilitate that with LDAT, so sharing ideas and knowledge. And hopefully this group here becomes a bit of a mini COP for you guys as well, where you can share ideas and learn as well. So, and we're obviously here to support you. I'm working full time, so I'm available if you want to reach out anytime on Teams or mobile or email. And I'm wondering if there's any communication method that you would prefer as a group.
Yeah, email's fine for me, but
Email works
happy
well,
with
yeah.
whatever.
Jessie, I think you mentioned Teams.
Yeah. I mean, if we can use Teams, I mean, it's not a bad idea to have a folder. If we had a Teams page, that we could access. Can everybody access an external Teams page? I don't know. It's tricky, right? Like there's like
Yeah.
firewalls inside of some organizations.
I don't
Yeah,
know
that's
whether
what I'm curious about, but yeah.
Mm.
So I am focusing. I'm just looking at Pip's message.
Oh, that's great.
I did message her to see if she's able to come. Oh, she's got a power outage, so no power internet. So I guess that's
That's her.
part of the challenges in Northern
Yeah.
Territory, isn't it? So
Yeah.
and part of the challenge of community work. So there we go.
Yeah. Next time, Pip.
Yeah. So you mentioned a Teams page. I haven't done that before, but I'm happy to look into it. So a
Oh, thank you.
Teams page that we could share.
Yeah, that would be good. I mean, I think like, by us. Oh, sorry, Fahim, you go.
Just a team page. We all having different team email, right? So it's like never used it before, so it's good between one organizations. Like our organization, we always. I don't know how it works.
Sorry, you broke up there. Your organization, did they use something like Google or something?
The team. I mean the Microsoft team, the same one you. But I don't know why it's when we using external to work with through the team, like the team, the Microsoft team, and you have to log in, log out, and all those things. So that was experience we used to have. I'm not sure if you have any.
I do find I got to sign in under a different email identity sometimes, the different Teams platforms.
Mm.
We can give it a try, and if Leanne, you're open to it, would you see if we can maybe see if we can make something work so we can all plug in?
Yeah, it is a handy tool if you can get it to work. Like you say, it's really good to be able to store those documents
in Teams.
Okay.
If we can.
All right.
Yeah.
So that's the terms of reference, and the most part. I mean, there is a little bit more to it, as well as the membership and minutes and papers, frequency of meetings. We're going to meet quarterly. We'll meet online unless we can all come over to Fahim's for lunch one day. That'd be great. But does anybody have any other? I mean, does anybody have any other questions about the terms of reference, or anything that we want to go through, or anything we want to dispute, or maybe consider changing or editing?
No, they all make sense.
Yeah, I'm pretty clear.
And if you're watching the recording, you can just send us an email.
Mhm.
So is that good? Is it terms of reference okay? We can approve it and move forward.
Yep.
Thank
Leanne,
you.
is there any kind of official process for approving the terms of reference?
Nope.
Just great. They're recorded. We all said it.
Approved.
Approved. Great.
You all
Wonderful.
passed the test. It's all good.
Done. Okay, so the other thing is there's an action and decision register. I don't know if everyone saw that. It was a Excel spreadsheet document that was attached. It's kind of blank.
Yeah,
Yeah.
just a way
Yeah.
of
Yeah.
Sam suggested that we do this, just a way of keeping track of
Yeah.
anything that's discussed and decided on. So
Yep. Yeah, thank you. And we do need to come up with a meeting schedule. Leanne has very graciously, if I'm not mistaken, offered to do the agenda minutes. Is that right?
yes, I'll do
Thank
that.
you. You're so
And in terms of
wonderful.
the meeting schedule, I think the terms of reference said quarterly, but I'm wondering if people would have capacity to meet perhaps monthly for the next couple of months before the end of the financial year, just
Yeah.
while we're kind of getting going and
Yeah, get some
looking at
traction.
and getting our plans together for next financial year, because we're kind of heading up towards end of this financial year. So April,
Well-
May, June. April's a very busy month, so I'm not sure how realistic that is. But yeah, I'd certainly would love to be able to try and meet if we could monthly until June.
Will people be okay with that?
Yeah, I'm
Should
fine
be
with that.
okay. Yeah, should be okay. I'm actually in the process of about to change jobs, but it should be fine.
Okay, well, we can pick a date in a little bit, but there's our first decision.
Okay.
Fahim, is that
all
cool with you?
That sounds have many things coming up in next 3 months, obviously. So until June, but after June would be much easier.
Okay,
More
so
than happy to go to the majority. So yeah, I will see. I mean,
what if we did 6 weeks?
6 weeks, a bit more. Yeah, makes sense. Yeah,
Is better?
Yeah,
my-
that sounds good for me. Yeah.
Yep,
Okay.
okay, that's great. So that'll get us, we'll still get in 2 before the end of the financial year. Is that about right? Does that look right to you?
Yeah, that sounds good. I have actually floated the idea. I think for him, you mentioned this as well, of possibly doing a face-to-face, but I can't. Since we're recording, I can't promise that. So ideally it
We're
would be nice to be able
exploring.
to, yeah, it would
Okay.
be nice to meet in person. But yeah, nothing fixed around that yet. So
And have Afghani food?
Yes, please.
Yes. And maybe we can do some salsa dancing lessons.
oh wow, okay,
I saw that on the list.
sounds exciting.
Salsa Bollywood. Well, it's good. I mean, it's quite valuable. Just on okay, cool. So everyone look at there's a LDAT Community Advisory Council work plan for 2024, which was an Excel spreadsheet.
Yep, I got
People
that open here.
Great.
Yeah, it's really just around, we've obviously got a bigger one because we do community practice for internally for staff as well. So we sort of have a bigger document that covers staff and LDAT. And it's just a place where we store things like the topics for the COP sessions and just relevant information about those sessions so that we can kind of reflect and hopefully improve. So it's just another way of recording any sort of
It's almost
discussions or
leaving.
ideas that come up. Yeah. You're
And
right.
so we all there?
Just I have to leave this room, but I'll go to the next room. Just by the time I'll turn my camera off.
Okay, that's fine. While you're doing that, if we were to click on the tab, oops, wrong tab. If we were to click on Community Advisory Council meetings, we plug in the next date. We could probably look, if we went off 6 weeks, we could plug in a date for the end of April. Would
Yeah.
everybody
Okay.
be okay with that?
Let's
Is there a
do that.
preferred day of the week for people?
At the moment, like I said, no.
None of it's good, right?
At the moment,
Never a good
no
time.
preference. I don't
And
know
that's-
what my new kind of roster will look like.
What's the new role? What is it?
I'm going to oversee a community theatre and arts centre.
Oh,
Oh,
cool.
great.
Yeah, I'm very excited.
That is very
In-
exciting.
In
Yeah.
Perth.
So,
Yeah, in the city of Kwinana. Yeah.
congratulations.
Thanks.
Very cool.
You'll have to
Ooh.
give us, we have new contact details or?
You currently contact me on my personal email address, so that's fine. That'll all stay the same. And the telephone number you've got for me is my personal one as well, so that's fine.
And when do you start your new role, Emma?
The 8th of April.
Just make a note of that. Yeah,
Fantastic.
the last week of, in terms of dates, the last week of April, I would only be available on the 22nd, but because that's Anzac Day that week.
Oh.
Right. Yeah.
Oh yeah. Wait, what day is that?
Anzac Day is the 25th.
That's a Thursday, I think.
It's a
isn't it?
Thursday, sorry. Yeah.
Oh
it's
gosh,
Thursday.
man, that's great. Okay, cool. I only
It's a-
say
I
that.
wouldn't be able to do Mondays
Okay.
if that was the day. I'm just currently, yeah, I think 2 weeks after that or the week after that I'll be right, but not that week.
Okay. The week after I can't do, but if
Oh, okay.
Sam's available, no, Sam's not available either. I'm on Norfolk Island that week after, so
Oh yeah, yeah.
um,
What about the 19th of April? I know that brings us back a little bit, but
that's a Friday. Yep, yeah, I can do the 19th.
That's it.
What time do you think we'd be meeting? The same time, so 3:30, or?
The only
I'm just currently finishing off placement for my counselling degree. So
Oh,
I'm at a high
congratulations.
school. Yeah, thank you. Just I'm at a high school on Mondays and Fridays until 3:30. So, but then I've got to hike at home to get online. So I'm just working, yeah, Tuesday through to Thursday
Okay, so
just
what
gonna.
at the moment.
What about the
what day
18th?
time?
It's tough.
The 18th, yeah.
Yeah, 18th is good for me.
I don't know. What do you think, Emma? Is that too close to you're starting your new role?
It should be fine. Like I say, I don't have my calendar. Hopefully, will be pretty clear for my first few weeks.
Yep.
While I settle in. Yeah.
The only thing is Sam's well, your WA time as well, Emma. So I'll try and make them in the afternoon just to factor in that 3-hour time difference. So
Like 3:30?
does that work for you, Kate?
Yeah, on a Thursday, that's fine.
So
I
that's
know.
the
I know we were saying 6 weeks, but this kind of brings it a little closer to the original 1 month. Let's just. What happened to Fahim? He was moving rooms. Wonder if we can.
and then
Where did he go?
6 weeks would be the end of May.
What do you guys think?
I'm happy with either. Like I say, until I start my new job, I can't 100% say, but with certainty.
Yep.
So I think I'm going to sneeze. No, it's gone.
Oh, that's the worst. Oh gosh.
It'll come back.
Yeah.
So yeah, either or for me is fine. I'll make it work.
Okay. So tentatively,
Especially if it's 12:30, because that's basically lunchtime anyway. 12:30 WA time.
Emma, do you have a standing desk?
Yeah.
Yeah, me too. Yeah.
I was just thinking about sitting down though.
Oh, really? Oh, yeah.
Yeah, I just had lunch, so I'm standing up to
I need a standing desk.
work it off. I've got it's just something from Office Works that goes on top of my normal desk.
Yes. Yep.
Yeah.
That's it. Yep.
Yeah.
And Leanne would appreciate this next comment. And Kate, I'm just talking to your point. And there's a guy named was it Bauman? What was his first name? It skips my mind right now. Who did a study that identified that sedentary lifestyles, especially like people who sit around, have a shorter life expectancy. So
Okay.
Thank you.
you're welcome. Yeah.
Thanks, but yeah. All right. I'll stand
Andrew.
up now and then.
Yeah.
That's
We did a walking
Now that you've
challenge in my
shamed us into
previous job.
sitting.
We did like we did a step challenge in my last job, and I put my phone as my pedometer, so I put it in my pocket.
Yeah.
And I'd be at my standing desk just marching on the spot,
Yeah.
trying to get
so
my
good.
steps up.
Yeah, Emma, I used to work with this guy, Charlie, who on a council hard rubbish skip day picked up an old treadmill and brought it into the office and put it under his desk and would use
Yeah.
that.
Great.
Valentina.
Hello,
That's
Valentina.
fun.
Oh, what a lovely
Hi,
surprise.
everyone. Hi, I'm so sorry I'm late. I had a meeting clash, and so I just thought I'll come late better than never.
Yes,
Beautiful.
that's right.
That's
Nice
great.
to
Great
see you
do.
all.
Likewise. Thank you. Hey, Valentina, while we're talking about meetings, can you do the 18th of April at 3:30?
Yeah, I'll check that now.
Cool.
Great.
And so, Emma, I did get a stepper at one point, and I put that at my desk, but it kept squeaking. And so I was doing this, and you heard, and people were like, "What are you doing?" I'm like, "Oh,
Oh,
sorry."
I like that idea. I like
Yeah.
the idea of a stepper.
Yeah,
Yeah, that would be
totally
good.
works.
I feel like
I can do it. Yay.
Oh,
You can do
great.
it? Great.
I can do the 18th. Yeah.
Got something to put in our action decision register, so that's good.
So I'm
Um,
familiar with Valentina, but does everybody else know Valentina?
No.
Oh, what a great opportunity. Okay.
Mm.
So, Val, how about Valentina? You want to introduce yourself, Valentina? Maybe where you are, where you work, your involvement with the ADF's LDAT program as well. Thank you.
Great. Okay. Thanks, Jessie. So I'm Valentina. So I'm here on Darug land in Sydney, and our organisation covers a little bit of Darug land, but mostly Gadigal and Bidigal land. So it's more southeast Sydney part, basically, our organisation and the LDATs that we run as well. So we've been running LDAT projects for a while. I can't remember how long now, quite a number of years. First in the all in the southeast Sydney area, but we've been running a lot in St George and Bayside local government areas, St George area, and then more recently in the Sutherland area as well. So we've been I'm very passionate around, I'm the CEO, I should say, from To Connect Youth and Community. We're a youth specialist organisation, and we've been operating as a non-profit for over 33 years. And I've been with the organisation for over 23 years, and very passionate around working with young people, particularly multicultural young people, and definitely around working with young people with drug and alcohol concerns and their families. Been doing a lot of work in that space in terms of working with young people with drug and alcohol concerns and their families. And the LDATs that we've been running have been fantastic projects. We're currently running one is a multicultural focus program. I'm working with the Nepalese and Macedonian communities. And we've been doing a lot of work with leaders, community leaders in those communities, and partnering with them. So that's been working really well. We've been producing lots of educational information, translated and in language information and support for the communities. And then the other LDAT project we've been doing is working with young people, specifically in the Sutherland area, who are at risk, and doing a lot of alternatives to drug use sort of programs there. So I'm not sure how much else to go in, but I'd love to meet Emma and Kate. Yeah. Sorry, I've just come out of this other meeting and my head's a bit full. It was with the funding. It was with the funding body too, so it's just quite a big program that we have, our employment services. So my head is really full. Yeah.
Oh, thanks for jumping in.
Maybe you could stand up. You could do like a little salsa dancing, a little Bollywood. Maybe I'll do a little Bollywood.
Did you know I do Bollywood and salsa?
Well, it's not that I'm psychic. It's that I read your bio.
I forgot I put that in. You're great, Jessie. You're so good at reading those bios.
No, I was just thinking. I was like, we were thinking about how we learn from each other, and I was like,
I love it.
Well, actually, Leanne said maybe we can get together one day, and I just said if we did, it'd be great to get some salsa, maybe Bollywood dance lessons, practice together.
Yes.
I've suddenly changed all meetings to online.
That'd be fantastic. I actually did that. I actually did some Bollywood teaching a Bollywood class at a national conference for the Reconnect Youth and Family Service once, many years ago.
That's so cool.
That's
There you
cool.
go,
Thanks,
there's an
Jessie. You're
idea.
amazing that you
No, no.
read all that and remember all that. That's great.
Okay, Kate, you want to introduce yourself?
Yeah, sure. Hi, Valentina. I'm Kate. I work for Blue Light Victoria. So down in Melbourne, I think I forgot to add that, where I was located before. We deliver programs to primary school and high school students in partnership with Victoria Police. And we have been delivering programs for LDATs in a number of areas. So I can't remember how many I said it. I think about 5 or 6 areas across Melbourne that we're delivering programs in schools, which is, yeah, really amazing. But yeah, mainly for the Blue Edge program in high school, so year 7 to 9. So it's a quick introduction. I'm the school's program manager.
Nice to meet you, Kate. That sounds
Yeah.
fantastic. Great.
Yeah.
And Emma.
Yeah, hi Valentina. I'm from WA, I'm in Perth. I am involved in the Rockinham's local drug action team and been involved in a couple of different local drug action teams across the metro area over the last few years. I work currently with a company called Outcare that does justice services, but will soon be moving roles and moving into the arts and culture space. Yeah, that's me.
Oh, fantastic. Lovely to meet you, Emma. That sounds great. And I love the painting behind you. Love the colours. And
It's a very sad painting, actually. It's called Prison Yarn, and it's
Yeah.
the gentleman in the middle is kind of yarning and missing his wife and child. And
Oh,
yeah, it makes me a bit sad when I see that. But it
Oh,
was
that's sad.
it was painted by one of our clients that had left prison.
yeah. That's a
Emma's,
very important messages there.
Yeah.
Emma's moving into a new role.
Oh, wow.
Yeah. So
What
I'll be
role are you moving?
moving out of the justice space and moving back into arts and culture. So the job I'm doing now is the exec manager of operations. So I kind of do the corporate services, HR, finance, fleet. It's not really my passion piece, although what we're doing helps our staff support their clients. I'm missing that direct community connection that I've always had. So I'm going to be overseeing a community arts centre, which is definitely much more, I think it's going to fill my cup a bit more than what I'm currently doing. The organisation I'm working for is amazing. They do fantastic work. Just being in that corporate service space it's just not really me.
Oh, yeah. That
Soul
sounds
work.
amazing.
Yeah, I need my soul work back. Yes.
Yes.
But being involved in the Rockingham LDAG, I do that in my own time, which my work is completely supportive of. That helps keep me connected to community. So I've been really lucky to have been involved in that. Yeah.
Oh, great. That sounds like a good move going back.
Yeah. Yeah.
And Valentina, I'm assuming you know Leanne.
Yay.
Yeah, I remember you way back, Jessie's mentioned already, LDAT days back in New South Wales.
Yes.
Yeah. So
Yes.
I think I actually yeah, and I think I actually worked with you with your LDAT for a season. Like I think you've had a few relationship managers. You've done the rounds, haven't you, from ADF?
We have had a few, but it's lovely to see you again, Leanne. We have worked over the years at various points. Yeah, it's fantastic.
And
we're working on this together.
Yeah, that's right. So I've kind of gone from Emma, you were talking about sort of shifting back towards more sort of community work. I've sort of come from working in the community by working on the LDAT program, mostly in Southwest Sydney. And now I'm in a different kind of role, so sort of more oversight nationally. So it's good to be through different stages with the program. I've got a lot of head and heart for it, so been around for a while. So, but it's really nice to see you again. Thanks for staying with the group. Valentina was actually, were you deputy chair or you were chair for a season?
I was deputy chair at one point. Yeah.
Okay.
Hey, can we all update? Can we do under actions? Can we update our bios? Maybe we can circulate an update. That would be great. And Leanne, would you put yours in too?
Oh, okay, sure.
Yeah.
32-year-old
That's right.
Bollywood dancer, yeah.
That's right. Yeah. And I know we're being
That's great,
recorded.
Leanne.
I know we're recording this one, Valentine, but I'm gonna put it out there. Like I have taken salsa dancing lessons a long time ago.
We'll have to put that on the recording. Yeah.
Just putting it out there.
That's great. That's great.
Yeah.
And Leanne, we're very lucky to have you, all your valuable
Yes.
experience. It's
Well,
great
thank
from
you.
ADF. It's fantastic.
Yeah.
Put that on the
And,
recording too. Yeah.
Thanks. Hopefully Sam, our
Memorialize.
manager's listening. Yeah.
Yeah.
Yes. No,
She
we're very
does. She
grateful.
apologises
Great.
for not being here because she's not well. But yeah, we were just talking about meetings schedules, Valentina. So the terms of reference said that we aim to meet quarterly, but I just suggested if we could try and fit a couple of monthly ones in just to kind of get some traction before the next financial year, that would be great. And I'll just let him back in. He's back.
Oh, look at that
Oh,
new
for
room.
him still on it. Great.
Wow. Looks like
Are you
he's
in?
driving in a fancy modern spaceship.
That's
you're on
good.
mute.
Fahim could stay as well. That's good.
Yeah. I'm gonna say it. Fahim's great. There you go. It's on the record. I did like working.
And you're great. You're great too, Jesse. It's
Oh,
fantastic.
I-
Yeah,
well,
it's great
it-
that you could stay too.
Thanks, Valentina. I was very impressed with who's here. It's like really cool. And that's why I thought,
Yeah.
bios will be helpful. If we can all update our
Yeah.
bios, that'd be great.
Yeah.
Hey, so Fahim, we did say that we wanted to pick a date. And the date that we kind of like got to was the 18th of April. And I know you were saying also that, later on would be better, but are you available in the afternoon of the 18th of April, like 3:30 by any chance? Are you
Yeah.
dry?
Yeah, April is good.
Yeah.
So sorry
Okay.
if I get disconnected for a few minutes. Obviously, I just have to change room, and the internet was a problem, and so now it's better now.
It's much better actually. Yeah. Okay, great. Okay, do we want to pick I know this is ahead of the agenda, but do we want to pick another date, maybe in June?
Oh.
Is there any preference, guys?
No, no preference my end.
Do Thursday the 6th of June.
I'm doing my hair that day.
Right.
I'm just kidding.
Really?
Well, that
No,
shouldn't take
no.
long. Sorry.
I didn't know if you were kidding or not.
No, I'm totally kidding. Yeah, that's fine.
I'm good for the 6th.
Yeah.
I can't. I'd have to do it earlier, like 1 o'clock or after 4, which I don't think.
It could be a
not
different day.
ideal.
Doesn't have to be.
Yeah, on the 6th I could do after 4 or between 1 and 2, which would be 11 Perth time.
That's okay.
Emma, you don't know what you'll be doing.
No, but so I'll
Okay.
get it scheduled in.
Okay. Fahim, what do you think?
Sounds right for now.
Sounds okay?
Yeah.
Sounds good. Leanne, will you send out calendar invites? Thanks, Valentina.
Yes.
Great.
Yes.
Good.
So
Okay, that one's
Thursday
done.
the 6th
Yep.
at 1 o'clock. Is that?
Yep.
Agreed. Yeah. Okay.
Everybody's good. So that's great. We got 2 in. So we're just gonna leave that other business item. Can we go back up to community practice updates? And Sam's not here, but Leanne's here. And I'm really interested in that first topic, the community practice sessions. We want to talk about it? Is that okay? Or do you want to wait till Sam's back?
Sure.
Or?
Yeah. So basically the background is I came into the role in October, and we obviously have our own targets that we're trying to kind of reach through our business planning and deliverables to the funder. So we're a little bit behind targets for this financial year, but that was just because I've sort of started a bit, in October. So since October, we've had 4 community practice sessions for LDATs that we've offered. I think we had one in November, December, February and March. So, and the topics that we covered were one was on with the new LDAT solutions program. So we basically refreshed the LDAT program based on feedback from LDATs, and obviously put it online. So there's now a digital platform that you can put your CAP into, your community action plan, and all the resources are in there. So we've done one COP session on the type 1 CAP, as we call it. Is everyone okay with the acronyms? I just assume people understand what I'm talking about when I say CAPs and COPs and
Yep.
it just sort of rolls off the tongue too easily. But yeah, so we've had the first one was on the type 1 CAP that we call, which is the community engagement and mobilisation. So that's the little mini one that allows LDATs to do community consultation. And then the next one we did a bit of a showcase because it was at the end of the year. And with each one I've tried to sort of get LDATs actually involved themselves, so speaking and telling their story about what's happening, and interviewed by their relationship manager from ADF. And then we've had one on the social connection toolkit, which is I think the one Emma you spoke at. And we've also, the one this week we had was around the new Aboriginal and Torres Strait Islander drug and alcohol resources that the ADF has sort of co-designed through some Victorian funding. So yeah, so we've had a few. We haven't had a huge attendance. We've had sort of between 20 and 30. So I'm curious to know, I will hear from you guys, I guess, how we can improve on that, whether it's the topics or it's the format or the timing, or if there's any kind of technical glitches. So we've got a number of ideas for topics, but also really keen to hear from you about what things would be helpful in terms of facilitating that sort of knowledge exchange and sharing experiences. So one of the things that we are thinking for the next, I'm trying to do sort of one a month, because it usually takes 2 or 3 weeks to plan these things. Sorry, I'll just turn that. After Jessie said, make sure we're focused in the meeting, I forgot to turn my phone onto silent. My apologies. But yeah, we are thinking for the next COP session for LDATs to try and do one of the programs in each of our toolkits, which we did a lot of research on to come up with the evidence-based programs that we suggest in there. They're not prescriptive, but they're just a suggestion. There's been some feedback that would be really great to hear some more about those programs and have a think and discussion about the actual implementation of those programs through CAP. So we're having some conversations with our futures coming up this week. So I think it's used to be climate schools. So that's a drug and alcohol education prevention program for schools. So that's a possibility. They might be able to do one. But yeah, so that's a suggestion that's been made for a topic for future. But yeah, does anyone have any thoughts or ideas on, I don't know if people have been able to attend any of the sessions or had any feedback they wanted to give?
Suppose the only thing I noticed from a couple was and I suppose it was the time of the year, but the numbers dropped off a bit at one point. And yeah, how do we sell it? How do we sell it so that people are excited to come to it, you know?
Because obviously, yeah, we really want it to be a space that is sort of peer learning, I guess. So it's for LDATs and run by LDATs. It's been sort of the ultimate goal. But
Did we send out a survey?
Yeah.
Did we get those topics from survey, like from the people, from the hundreds of LDATs out there?
For the actual sessions that we've run, the last 4, I think we've done surveys at the end of the session for this one this week and the last one. So I'm not sure. I haven't actually looked at those to see what the response rate was.
But what? Not for the people who came to the last one, but for and forgive me for my ignorance. Maybe this is already happening. I missed it. I'm sorry. But have we sent an email out to like all the LDAT emails asking, what topics and subjects, they might like to, hear on, learn on?
Not recently, no.
Yeah. Would that be something that we could do?
Yeah.
And just something like that kind of like reinvigorates, as like Emma was saying, cells, the community of practice.
Yeah, and not just the topics, because there is that education awareness piece, but also that emphasizing the benefits from the collaboration and for the connection, and yeah, because that's what I get out of it. You know, I hear a topic, I hear a presentation, and the content is great, but what it sometimes sparks in me is, oh, actually that one piece you just talked about, we've been talking about something similar, but we haven't quite got there yet, or it's a bud of an idea, and can we connect afterwards and speak about this or that? And those connections are really handy. You know, with 200 odd LDATs, if you're thinking of an idea, the chances are someone's done it and has learnings from it.
It's true.
Yeah.
Yeah.
So what if we,
That was,
so if we did that, right, we can then come back and like look at, you know, what people have suggested and theme out, and we'll pull some, extract some themes, and you know, maybe they'll identify, you know, specific ideas or presenters, you know, like.
there was a survey done, not this financial year, but the one before, that would have included staff and LDATs. So, and some of the topics.
Okay.
There were topics suggested then,
Oh dear.
which
Oh yeah.
we've done some of those topics. I can just
Yeah.
have a look. Obviously the one that we did around the type 1 cap, which was identifying drug and alcohol issues in your community, that was one suggestion. And then obviously going through the new toolkits was another topic that we sort of went through last year, before I came on board, and also since October.
If you don't mind me saying, sometimes I find that, you know, we're working in community development space frequently, and it's such an exciting space to be working in because of the connections and the networking and, you know, what the work that we do. And there's different models and approaches that have come across that have been quite handy, and people who I work with have gained, I guess, insight and, you know, experience from. And so there's something called like appreciative inquiry, and you know, that's an example, or asset-based community development is another one. And I do know some people who could, you know, come on and provide a presentation and overview as like how we do some of this work. Because I think shifting from a deficit model into an asset model, you know, like, you know, what are your strengths and how do you, you know, use them, really inspires community and community involvement and movement.
That's a good idea. Yeah, that's a great idea. I've seen some presentations on the asset community development. They work really well to inspire people more as well.
So I met with someone from the Jetter Institute last week who was passing through Coffs Harbour, and we sat down for an hour and just talked about asset-based community development application inside the space and how you apply it and what you can do. And you know, I mean, there's so many things out there that, you know, I think that people would want to learn about. It might actually, you know, we might find that, you know, we want to increase the number of COP sessions as well, you know, if we can roll something out. And so.
Yep, no, that's a good point.
Yep.
Maybe if I put some of those questions together and put it to you guys as a group, and if you want to answer those questions, and then we can
start there.
broaden that out, maybe to all LDATs. Put that in the work plan.
That's great. Thank you, Leanne. Okay, and so we're at time. We're either gonna, anybody got anything else? I'm sorry, we're at 4:30, and I know there's always more to talk about.
No, I think that's great. Yeah, good job.
Anybody got
Thanks,
anything else? Oh, my pleasure. Anybody, anything else though that they want to say before we wrap up?
There is one more. There is one more thing. Sorry, has anyone got anything else?
Fahim too.
I just want to know is the last year and the year before, obviously the resources we had lots of conversation and discussion, and I'm sure there are minutes or recording of it where we can see those. Are they available anywhere that we can find it?
Well, that's a good point. Maybe we could put those in Teams also in that folder.
Yeah, you mean the ADF LDAT resources?
And minutes too, right?
Yeah, from the last meetings we had on last.
Oh, okay, from previous meetings. Yeah. Okay. Yeah, I can do that.
Oh, Leanne, we're loading you up with work.
I know. I'm up to 5 action points. I think I'll bring my coordinator next time.
Yes.
I said to her, "Don't worry, I'll be fine. I've
Yeah.
got it." Oh,
Yeah.
Between learning to dance and
Yeah.
action points, I'm getting a bit nervous. But anyway, it's good. Someone's going to help me out. Yeah. Look, the only other thing is, and it's just a governance thing around. We would like to have a deputy chair. So this is usually the point of the meeting when there's kind of silence. So, but I am putting it out there. I'm happy to put it out there now if anyone feels like they've got capacity and would be happy to support Jesse. Obviously, he's a fairly fantastic chairperson, but there might be times when we need support or someone else can step in to cover if he's not able to do it. So there's some more details in the terms of reference. But yeah, is anyone on the spot happy to do that, or shall I just leave it with you and you get back to me? Create an action item for me. Mind you, not everyone's here. So
Fahim just bounced. Can we hold that one to the next meeting and hopefully we've got more people? Is that okay? Yeah. And then put it out there then. That way we're not
it's an action.
Yeah, limiting anybody. Okay, cool.
Deputy. Right, thank you.
Great. Okay, guys. Well, 4:32. If everyone's got everything that they wanted to say out, we'll wrap up. Is there anything else that people want to share while we're together?
The next COP is the 11th of April. So yeah, really love you to be there. I'll try and remember to personally send you an invite.
Thank you.
It's on Humanitex. Yeah. Thank you.
Thanks,
I'm
everyone.
gonna stop recording now.
Okay. Thanks, Leanne.